Welcome to the Aging Well podcast, where we explore the science, stories, and strategies behind living a longer, healthier, and more purposeful life. I'm your host, Dr. Jeff Armstrong, and today we are diving into a topic that is absolutely foundational, yet often underestimated when it comes to aging well. That is, sleep. In this episode, we'll explore why sleep is not just a passive state of rest, but an active biological process critical for your longevity. We'll look at the mounting research connecting sleep quality and quantity with chronic disease risk, cognitive decline, immune resilience, and even genetic aging. We'll walk through how sleep affects everything from your emotional well-being to your physical vitality. We'll uncover the science of sleep debt, the critical role of individualized sleep needs, and the essential strategies for optimizing your sleep environments and habits. Most importantly, we'll connect all this back to the big picture: how sleep fits into a lifestyle built around extending your health span, not just adding years to your life, but life to your years, to how sleep helps you age well. We often talk about exercise, nutrition, and mental health as pillars of aging well, and they are. But sleep is the silent partner holding it all together. Without sufficient sleep, high-quality sleep, the body's systems, from metabolic regulation to immune surveillance, begin to unravel. Decades of research have shown that chronic sleep deprivation is associated with an increased risk of almost every major chronic disease: heart disease, type 2 diabetes, obesity, Alzheimer's disease, depression, all show strong correlations with inadequate or disrupted sleep. In fact, the CDC has called insufficient sleep a public health epidemic. Sleep is also a powerful regulator of systemic inflammation, one of the key biological drivers of aging. Short sleep duration has been linked to elevated inflammation markers like interleukin-6, tumor necrosis factor alpha, and C-reactive protein, all of which are associated with accelerated aging and chronic disease. When we routinely shortchange our sleep, we also accumulate something called sleep debt. Much like financial debt, sleep debt adds up over time. It carries a heavy interest. Research from the University of Pennsylvania has shown that even modest sleep restriction, say sleeping 6 hours a night instead of 8, leads to cumulative cognitive deficits over just a couple of weeks. More alarmingly, sleep debt has been linked to telomere shortening, the fraying of the protective caps at the ends of chromosomes that is considered a hallmark of aging. In short, poor sleep just doesn't make us tired. It ages us at a cellular level. So, how much sleep do we actually need? The National Sleep Foundation and a wealth of epidemiological studies recommends about 7 to 9 hours of sleep per night for most adults. However, it's critical to recognize that individual sleep needs to vary based on genetics, lifestyle, and even health status. Some individuals carry genetic polymorphisms, like variations in the DEC2 gene, that allow them to function well on less sleep. But these are rare exceptions, not the rule. For the majority of people, consistently getting less than 7 hours per night leads to measurable deficits in cognitive performance, emotional regulation, immune function, and even metabolic health. In older adults, sleep architecture, the structure of sleep across the night, changes. There is a natural decline in slow-wave sleep, which is the deep, restorative stage most associated with memory consolidation and physical recovery. At the same time, older adults often experience more nighttime awakenings and lighter sleep. This makes it even more important to be intentional about sleep hygiene as we age. When we get high-quality, sufficient sleep, the benefits ripple throughout the body. Cognitive function improves, particularly memory consolidation and executive function. Emotional resilience strengthens, reducing the risk of depression and anxiety. Immune function is bolstered, making us more resilient to infections and even possibly reducing the risk of cancer. Metabolic processes stay better regulated, protecting against insulin resistance and weight gain. In short, sleep is not a luxury, it is a biological necessity, deeply entwined with our ability to age well. One of the most important and often overlooked factors in the relationship between sleep and aging well is the presence of sleep apnea. Sleep apnea, particularly obstructive sleep apnea, is a condition where the airway repeatedly collapses during sleep, causing brief interruptions in breathing. These interruptions often go unnoticed by the sleeper, but they trigger a cascade of physiological stress responses throughout the night. Every time the airway closes and oxygen levels drop, the body jolts into a state of emergency. Heart rate spikes, blood pressure surges, and the brain is briefly awakened just enough to disrupt deeper stages of sleep. Over time, this fragmented sleep leads to serious consequences for overall health. Sleep apnea is not just about feeling tired during the day. It promotes chronic systemic inflammation, elevating markers like C-reactive protein and tumor necrosis factor alpha, both of which accelerate biological aging at the cellular level. It significantly increases the risk of cardiovascular disease, including hypertension, heart attacks, atrial fibrillation, and strokes. Metabolic health also suffers. People with untreated sleep apnea are more likely to develop insulin resistance, gain weight, and eventually progress to type 2 diabetes. Perhaps even more concerning is the growing body of evidence linking sleep apnea to cognitive decline. Repeated drops in oxygen and disrupted REM sleep impair memory consolidation and executive function, setting the stage for early dementia and neurodegenerative diseases like Alzheimer's. In fact, studies have shown that people with untreated obstructive sleep apnea tend to have shorter telomeres, those protective caps at the end of our chromosomes, suggesting that their cells are aging more rapidly than they should. In addition to the physical impacts, sleep apnea takes a toll on emotional well-being as well. Individuals often experience higher rates of depression and anxiety, likely due to a combination of poor sleep quality and chronic low oxygen levels affecting brain chemistry. The good news is that sleep apnea is highly treatable. With proper diagnosis and interventions like CPAP therapy, oral appliances, or in some cases, newer treatments like implantable nerve stimulators, many of the risks associated with sleep apnea can be dramatically reduced. Research shows that effective treatment can lower cardiovascular risk, improve cognitive function, stabilize mood, and restore energy levels, all of which are essential for aging well. I found that trying to get treated for sleep apnea can be quite difficult. It seems like the medical community is much more willing to treat our symptoms, give us pills, give us something that is going to mask the symptoms that are really the result of poor sleep. For myself, it's been about a year in the process of trying to get diagnosed and treated for sleep apnea. It took me about 6 months with my physician to get him to schedule a appointment with a sleep doctor. And to get that appointment with the sleep doctor, getting the sleep test study done, and then getting the results of that, and then getting the device to actually be delivered to the medical center, and then ultimately having to pick it up and get trained and use it. So I haven't yet to start. I have another week in myself personally before I even begin to get treated for sleep apnea. And so kind of watch this podcast over the next several months and kind of see the progress. My bet is that I'm going to lose about 20 pounds and my cholesterol levels are going to drop and I am going to feel much better, much stronger, and I'm going to age well. So if you feel like you have the potential for sleep apnea, if you're somebody who everybody complains you snore, you're not getting good sleep, you're not feeling rested in the morning, or if you're like me and you monitor your sleep and you're seeing your sleep scores, your heart rate variability all being affected, then get tested. And it might take some time to get the treatment, but it's going to be worth it in the long run. And so when we talk about sleep as a pillar of healthy aging, it's critical not to overlook conditions like sleep apnea. Identifying and treating it is not just about getting a better night's sleep. It's about protecting your brain, your heart, your metabolism, and ultimately your lifespan. Given how critical sleep is, how can we protect it and optimize it? First, establishing a relaxing bedtime routine is essential. We refer to this as sleep hygiene, one of our 6 pillars for aging well. We often talk about the importance of circadian rhythms. About an hour before bed, begin signaling to your system that it's time to wind down. Dim the lighting, turn off screens, especially blue light emitting devices, computers, your iPhones, and so on. Engage in calming activities like reading, light stretching, or taking a warm bath. These signals help shift your nervous system from sympathetic fight or flight mode to parasympathetic rest and digest mode. Second, optimize your sleep environment. The ideal bedroom is cool, between 60 and 67 degrees Fahrenheit, dark and quiet. If ambient noise is an issue, consider using a white noise machine. If light pollution creeps in, blackout curtains or a sleep mask can make a world of difference. Your bed should be a haven reserved for sleep and intimacy, not for working, eating, or scrolling through your phone. Third, lifestyle factors like exercise and diet play significant roles. Regular physical activity improves sleep quality, but it's important to time it wisely. Vigorous exercise too close to bedtime can actually stimulate the nervous system and delay sleep onset. In terms of diet, avoid heavy meals, caffeine, and alcohol in the evening. Alcohol may make you feel sleepy, but it fragments sleep and suppresses REM sleep, which is crucial for cognitive and emotional health. These environmental and behavioral strategies form the foundation of good sleep hygiene, a key pillar of aging well. Even with good sleep hygiene, many people struggle with sleep quality. Here are some additional techniques that can help deepen and improve sleep. Mindfulness meditation has been shown in clinical trials to improve insomnia and increase slow wave sleep. Practices like progressive muscle relaxation, deep breathing exercises, or guided imagery can help calm a racing mind at bedtime. Melatonin, a hormone naturally secreted by the pineal gland, can be useful for short-term support, especially for circadian rhythm disorders or jet lag. However, it's important to use it judiciously, ideally at low doses, 0.3 to 1 milligram, and under the guidance of a healthcare provider. Too much melatonin can disrupt sleep architecture and create dependency. It also has a relatively short half-life, roughly about 2 hours. So it might get you to sleep, but it's not going to necessarily keep you to sleep. Because of this, I recommend Sleep Relief from MB Health. Dr. John Neustadt was a guest in episode 152. Herbal remedies such as valerian root, chamomile, and lemon balm have also shown modest sleep-promoting effects in some studies. Again, quality control and appropriate use are an important consideration here. And finally, consistency is key. Going to bed and waking up at the same time every day, even on weekends, anchors your circadian rhythm and improves sleep efficiency over time. Sleep is not something we can binge on the weekends to make up for weekday deprivation. Likewise, having good regular sleep hygiene during the week and then blowing it on the weekend can shift us into a different time zone by the time we're ready for work on Monday. So the brain and body crave and need regularity. So try and have a regular bedtime, get up at the usual time, even on the weekends. Ultimately, we need to view sleep as a non-negotiable investment in our long-term health and vitality. Prioritizing sleep isn't about being lazy or indulgent. It's about recognizing that this fundamental biological process underpins nearly every aspect of our well-being. Research from studies like the Whitehall 2 cohort and the Nurses' Health Study show that individuals who report consistent, high-quality sleep in midlife enjoy better cognitive performance, lower risk of cardiovascular disease, and greater longevity. Over time, cultivating healthy sleep habits leads to lower systemic inflammation, better glucose metabolism, enhanced neuroplasticity and cognitive reserve, more resilient mood regulation, and protection against frailty and sarcopenia in older age. In other words, protecting your sleep today is protecting your ability to thrive tomorrow, physically, mentally, and emotionally. As we seek to age well, sleep is not something we can afford to sacrifice. It's a cornerstone of resilience, longevity, and joyful living. And it deserves our attention, our respect, and our daily commitment. Thank you for joining me in this brief exploration of sleep and longevity. If you found this episode helpful, please consider sharing it with a friend or family member who can benefit from understanding the incredible power of sleep. And as always, remember that aging well isn't about perfection. It's about consistent, intentional choices that support your long-term vitality. Until next time, sleep well, live well, keep investing in the most important project of all, you, and keep aging well. Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.